So now I'd like to call up Dr. Neti Juniarti. I'm sorry, Dr. Juniarti, I'm really terrified that I'm mispronouncing your name, who joins us from Indonesia. So welcome, you're very welcome, and will be talking to us about the effectiveness of intervention in the nursing care model to improve self-management of hypertensive patients in Indonesia.
Thank you, Dr. Brown. It's very happy to be here to present, to share my research from Indonesia. The title is The Effectiveness of Intervention in the Nursing Center Model to Improve Self-Management of Hypertensive Patients in Indonesia. And I would like to acknowledge my team, Siti Johri Nasela and Ahmad Yamin, and we are all from Faculty of Nursing, Universitas Padjadjaran. I know it's hard to pronounce, in Bandung, West Java, Indonesia. So, okay. So, in Indonesia, integrated care is still underdeveloping compared to other countries, but I am really passionate to develop the integrated care model in Indonesia, and my capacity at the moment is just to reorienting a way to give care, which is needed to provide efficient and effective healthcare using the primary and community services in Indonesia. And I also developed some strategies for coordinating services focused on ways on reducing the fragmentation of care delivery through improving continuity of care and relationships with people. And the nursing center model was initiated, actually it was in 2002, and I was part of this model. And since 2015, I also attend the first launch of integrated model in Edinburgh, and since then I'm really passionate and I really want to develop integrated care in Indonesia by implementing the model within my nursing center. So, and for this study, I focus on self-management improvement for hypertensive patients. And why hypertension? Because in Indonesia, the prevalence of hypertension is increasing. As you can see, in 2013, we have 25.8%, and it increased in 5 years period into 34.1%. And in my province in West Java, you can see it here, it's number 2 in Indonesia. So with a population over 260 million, 34% is more than 60 million people with hypertension, and it's a really growing problem in Indonesia. And so that the aim of this study was to analyze the effectiveness of the intervention in the nursing center to improve the self-management of hypertensive patients in Indonesia. And for the conceptual framework, I use my own conceptual framework for the nursing center. This model aim to integrate the community health nursing practice, education, and research. So at the moment, we just involve 3 areas: health services, nursing education, and research into the same model. So the integration hasn't involved other profession yet, but we are planning to go there for the interprofessional collaboration in the future. And by using this model, okay, we did our study using a pre-test and post-test with control group design. The sample was 35 people in the intervention group and 33 people in the control group. And the data were collecting using hypertension self-management behavior questionnaire before and after intervention. And the intervention was given based on self-management of hypertension protocol. And the intervention in the first week was conducted in the nursing center model and then followed by 3 home visits for 3 weeks. While in the control group, they just come to regular meeting at the community health center. And then we will compare the results at the end of the project. And the data was collected last year in 2018, and then we analyzed the data using RAS model and pair t-test and independent t-test. So this is the results. This is the characteristic of respondents. As you can see, probably it's too small. It's enough. The average age for the intervention group was 49.69, and in the control group was 52.64. Most of the participants are female, married, and they have low education, most of them in elementary and junior high school education, and most of them were unemployed or housewife, and they have income less than minimum regional wage, so it can be categorized as a poor family. And from the analysis here, it showed that the mean logic for post-test in treatment group was higher than the pre-test mean after receiving intervention in the nursing center model. And for the control group, here you can see there's slightly increased, but still at the lower level. And for the t-test, dependent t-test analysis, you can see that in the control group, there's no significant difference before and after they come to the community health center, but in the intervention group, after they come to the nursing center and then follow up by 3 home visits for 3 weeks, they show increase in the self-management for hypertension patient. It's really significant. And for the mean difference between groups, so in independent t-test, here we can see that in intervention and in control group, there's significant difference between these 2 groups. So we can say that self-management among patients who receive intervention within the nursing center is better compared to those who in the control group. Okay, so for why the patient in the intervention group can have increase in self-management. This is because the increase of self-management behavior in the intervention group occur because of the nursing center was designed according to a framework of 4C. So the first C is completeness. We design the intervention from health promotion and then health disease prevention and then curative. So we provide health education. We give counseling when the patient feel, because most of them are in the lower socioeconomic, so they feel stressed about their expenses, their life, and economic condition. So we give them counseling, and then we support them at home so we can really understand why they have the problems. And the second C is collaboration. So we work together with students, the families as well. And coordination, also we involve other health professionals such as nutritionists, because some patient need nutrition advice. And then for the continuity, they were followed up to their home, so there's no missing link in between. Okay. Yeah, and this study also showed that intervention led by nurses in the nursing center is effective to improve hypertension self-management rather than in a regular treatment, because usually in Indonesia, people with hypertension, they come to the community health center and then they see the doctor and then they chat for 1 or 2 minutes and then they give, the doctor give medicine and they go home. And there's no follow-up, and sometimes patient want to talk and to discuss with the doctor, but it's not possible because if you come to Indonesia, you will see that hundreds of patients come to community health center every day, hundreds to 200 patients. So it's really a hectic place, and with the model, we give time for patients to talk, to discuss what their concern is, and really involve them in the development and in to manage their own disease, their own hypertension. And so in this way, the patients and their families would become active participants, and they have responsibility for their own care and planning. So in conclusion, the intervention in the nursing center is effective to improve self-management of hypertensive patients in Indonesia. So the major lesson learned from this study is that completeness and collaboration, coordination, and continuity of care are important to improve self-management for patients as the most chronic disease in Indonesia. And the limitation, I think, is this one. Okay. So this study was conducted in one nursing center in Indonesia, so it's still in a very small scale. However, the study, the results perhaps could not be generalized, but the findings are likely to be applicable within similar settings. So the completeness, coordination, continuity of care, it might be applicable for other parts of country in the world. And finally, for further research, our team planned to do more research to examine the effectiveness of the intervention in the nursing center for other type of chronic disease self-management, such as arthritis, joint pain. That's also the second problem after hypertension in Indonesia. I think that's all from me. Thank you very much.
Thank you so much. If you just like to stay up here to take questions, and do we have any questions? Yes.
Congratulations on your presentation and the work that you're doing with that project. That's really well done. The numbers just astound me as an Australian when you talk about 30% of the population, I think it was, which is equal to 60 million people. And I just go, oh my God, that blows my mind.
Yes.
And but I wonder what that means in terms of the practicability of doing self-management with the nurse with such a massive, big population. Can you, I don't even know what exactly it is that I'm asking, just is it feasible to be perhaps doing this kind of work on such a big scale, or is it one part of the solution for this illness, if you like?
Yes, okay. Actually, we plan to scale up the project because this is a just first pilot project. So we plan to scale up for the whole Indonesian population. And it's very hard, because even in one small area we have like hundreds of people with hypertension. So that's why the traditional way is just they come to the community health center and then they give medicine and then they drink it. But sometimes the problem is not in the medicine. It's not the complex problem of people, because I showed you the demographic characteristic, because most of them are in difficult condition in economic or in their life status. And sometimes the problem is not just in the medication, it's the way of their life, their lifestyle, and how they manage stress and something like that. And we plan to enroll this program widely by training nurses, so the nurses can come to the community, because currently nurses really enjoy staying at the community health center and they give medicine. And we really want to encourage nurses to come to the people, to the community, go to the small area, small village, and then give this education, because we have a protocol for 4 steps education until they can manage their hypertension better. And hopefully we can do it in the future, but yeah, at the moment it's still in small scale.
So going to where the people are.
Yeah.
We've got a question here and then one over here.
Kia ora, Neti. Thank you to all the speakers who are all quite inspirational, really. My question follows on from that one, which is around the workforce and training the workforce for being in the nursing centre, because I guess if you're going to scale up, you're going to need a workforce to be able to do it. So what are the plans around that, and what do they require in the nursing centre?
Yeah, okay. Yes, thank you. And the workforce is what we come in the first place. I'm trying to move. Yeah. So the nursing center, maybe you can see this is my publication. So the first model was designed because to address the gap in the how we train nursing students in Indonesia. So in this nursing center model, we involve education institution. So they come together to look after the patient at home. So we train the students, nursing students, so they really get the idea, okay, so this is the new way to give better care for people in the community, not just stay in the hospital, or, yeah, just give medication. And then through this model, we hope, this is one example, I give you a picture of this. So this is the example of students and nurses. They come to the patient's home, and you can see the house is really, it's really small, and they are unfortunate category of people. And in this way, we educate future nurses so they can have compassionate care, and they really want to go out and outreach and just reach patients at their home. Okay.
Yes, thank you for your presentation. I'd just like to ask, because I'm medical, I'd like to ask the question of how you're defining hypertension, and how are you selecting people to intervene, and how do you really know they've even got hypertension if you're just measuring it in the clinic? Because a lot of people, when they go to clinics, have high blood pressure, and if you self-monitor them at home, they actually don't have it. They've just got low blood pressure. So I just wanted to open up the question of diagnosis and selection.
Okay. Yeah, thank you. So for the selection, we choose a patient who come to the community health center, and there's a doctor diagnose them based on their blood pressure. So we choose people with over 140 for the systolic blood pressure. So people over 140, and then we included them in the study. Yeah, and then we measure their blood pressure. When we do this intervention, we do blood pressure, the patient blood pressure at their home. I hope I answer your question.